Hi, I'm Donna Davis. Sorry we were a little bit late getting started today, but we're glad you're here. We are here with Dr. Marc Yune, a renowned plastic surgeon. He and some others, the nurses from his office, are going to be answering your questions, so we want it to be interactive. So thanks for being here today, Dr. Yune.
Well, thanks for having me, Donna. It's been a pleasure.
Yeah, let's talk a little bit about your practice and how you got started, your background, your qualifications.
Okay, well, I did my residency in head and neck surgery, and then I did a one-year fellowship in facial plastic surgery. And then the subsequent 3 years, I did traveling preceptorships in breast and cosmetic body surgery. So I'm triple board certified in head and neck, facial plastic, and general cosmetic surgery.
And you've also been featured on a number of networks as an expert to speak about plastic surgery, right? You've been on CNN and NBC and a few others.
Yeah, I've had the privilege of being able to share some of my information with the general public. I really enjoy doing that, so I think this is a great format.
And what do you think about doing plastic surgery? I mean, do you love it at the end of the day? Do you feel like just, you've made a difference in a lot of people's lives?
Well, speaking of privilege, it's really a privilege to be in this space because I have a nickname for this specialty. I call it happy medicine. We have an opportunity of really helping people's self-esteem. When you choose your patients wisely, we really enhance a life. So it's really fun at what we do. I feel like it's the perfect blend between art and science.
I think that it definitely is. I think that, and do you find that over the years it's even more art? Or no?
Well, I think what you have to do is obtain enough training where you can really understand what looks natural. And so what's interesting in this business is even though we're trying to accomplish a result, you really can't leave any footprints behind. You have to make it look like somebody hasn't had something done. And that's the art form of understanding what is natural aesthetics.
That's right, because I think a lot of us have seen people who've had a bad, facelift, for instance, and sometimes they look like, everything on their face is drawn up, and you think to yourself, I'd rather look old than look like fake.
Absolutely. I think one of the biggest problems in our industry is lack of training, and so with that, there's really not a lot of natural work being created out there. So there's a big opportunity to do revisional work, and some things you can't fix. So it's important to really find somebody that's thoroughly trained and understands that picture galleries help a lot. If you get to see a robust picture gallery in somebody's cross-section of their work, I think that tells you something.
And I think it's such an important thing for people to do their research, and I think they do, because it can make such a difference. And certainly there are people who can advertise that they do these procedures like facelifts, and they may or may not be plastic surgeons, correct?
There's no legislation in regulating who can do cosmetic surgery, but there's not a lot of opportunity in training for cosmetic surgery, which is kind of a double-edged sword. So I think that additional training should be mandated. For instance, I think you should have to do 100 rhinoplasties in training before you go out into private practice and do your first one. But that's getting off on a tangent. I mean, I think in essence what you really need to do is look at pictures, not just a piece of paper, because a piece of paper doesn't tell you what you trained in. It really tells you that you passed a test. So going beyond that, fellowship training, picture galleries, reviews, these things all matter.
Right. Yeah, you're right. We could talk about that for quite some time. You're right. We also want to talk about some cosmetic procedures. We do want you to ask your questions. You have a large staff, and you've got a couple of nurses with you today that are going to facilitate those discussions about cosmetic procedures, correct? Non-surgical ones.
That's correct. I brought two expert providers, two nurses, Sarah Reese and Casey Blevins. And what's unique about our practice is our training is very regimented and prolonged. All of our providers go through at least a year of dedicated training before they're doing devices and injectables. And so you're going to meet two of our experts just now.
Yeah, we have them coming up on the set. We're going to talk to Sarah Woodsides and Casey Blevins. You guys have a seat. And they are going to talk about some of their favorite procedures, and they want to invite you to ask your questions about all of this. So welcome to the show.
Thank you.
Thanks, Donna. I'm Casey. I'm a board-certified registered nurse.
And I'm Sarah. I'm also one of the registered nurses that works at Aesthetic Specialty Center.
All right, so we're going to first start out by just kind of asking each other, so what is your favorite treatment to receive and then also to treat patients with?
So at ASC, we have tons and tons of non-surgical devices, but we also do a lot of injectables. I think my favorite to do is injectables like Botox and filler. I have a background in, I was an ICU nurse before this, so I think that doing injectables, you can kind of bring like art and medicine together, and I've loved having the opportunity to do that. My favorite treatment to do in office is BBL. BBL stands for broadband light, and it's one of our, Casey actually does my treatments. She's awesome. It helps with brown spots. So think like brown spots that you get from age, from the sun, just over time, from maybe acne scars. Think of it as kind of going up under those colors and bringing them up. And then once that all flakes off, it reveals a nice, smooth tone and complexion. So it's a really great treatment for a nice glow.
Mm-hmm.
What about you? What is your favorite
So
to get?
And then I guess also to give to patients is microneedling. So microneedling, we have cold microneedling, and we also have radiofrequency microneedling that we call secret RF. But one of the best analogies I think that we have is Dr. Yune always says that we're born with this collagen bank, and then after the age of 25, we're spending from that bank every day, unfortunately. But then when we do a treatment like microneedling or with heat, we're depositing into our collagen bank. So all the collagen that you get out of that treatment is yours to keep, and it just plumps out the skin. The tiny holes that are created are then filled with collagen to help with fine lines and wrinkles. It also helps with your textural issues, and just gives you a more natural approach to anti-aging. What would you say the downtime for BBL would be like?
BBL is pretty minimal in downtime. That's always somebody's first question is, how long am I going to look weird? With BBL, you're a little bit red and blotchy the day of your treatment, but by the next day, your skin's calmed down. Some of those dark spots that we're trying to treat are maybe a little bit darker, and they'll kind of stay darker and maybe flake off over the course of a week or so. But as far as downtime, it's pretty minimal. I think we do a really good job of trying to prep all of our patients for what to expect. I think people do a lot better when they know what to expect. Microneedling is a little bit more involved for downtime.
It's a little bit more aggressive, but I would say that, you can be in makeup in 24 hours, but about day 3 or 5, you're about back to normal. But I think that, like to your point, you said just preparing patients on what to expect, kind of holding their hand throughout the entire treatment. I think that's something that sets us apart at our office at ASC is education.
Yeah.
We're always making sure that we're providing our patients with the tools to make the right choices for them,
Yeah, and I think Dr. Yune kind of touched on this in the beginning, and going back to that I love doing injectables is, coming to ASC, it doesn't matter who you're in front of, whose chair you're sitting in, you know that you are being treated by someone that has had extensive education and training. Dr. Yune puts a really big emphasis on making sure we're 100% comfortable with the treatments we're doing. We are experts in it. We know everything. With everything we do, I think, too.
Yeah, definitely. So I guess we should talk about some other things that we have at our office. We also have some female wellness, which I think is really cool about our practice because I don't think a lot of other practices offer that. So I guess the office likes to call me the female wellness guru.
She's the guru of female wellness. These questions are not asked often enough. We get a lot of women that come in for one thing, and as we get talking to them and kind of asking them their concerns and things that we can help them through their everyday life. Female wellness is one that comes up often, and I think it's really amazing that we have created an environment where people feel comfortable talking about that because, there's quite the stigma around that. And Casey is our female wellness guru, so I'll let her talk about some of the stuff that we offer.
I just think it's so important to start the conversation because a lot of women are either embarrassed or just, kind of settle with, okay, this is what I have, this is what's working, and this is what's not, and I can't do anything about it. But that's just so not true. So one of the things we have is called Cliovana. In their study, it showed that 75% of males will orgasm after every sexual encounter that they have, whereas women only 33%. So Cliovana helps us kind of bridge that orgasm gap. It's a 10-minute treatment. It's super quick. Really, anybody can benefit from it if you just want to have more intense and more frequency in your orgasms. It's a painless treatment. I've done it myself. Sarah's done it. And it basically uses sound wave technology to cause little micro injuries to the clitoral area, and then to stimulate blood flow and more connection of nerves there to make everything more sensitive. Another one that we have is called Thermiva. Do you want to touch on that a little bit?
Yeah, Thermiva is one of our, I think, highest patient satisfaction treatments. What Thermiva does is patients that come in and have issues with like incontinence after childbirth or just laxity, like issues with lubrication and just like overall, sexual satisfaction. Thermiva uses radio frequency, which is just a fancy word for heat. And then by applying heat to the external and internal parts of the vagina, you can get you're stimulating collagen again, and then you get that tightening. It helps. I think like incontinence is probably the reason that like women are always super happy about it.
You don't have to cross your legs anymore when you sneeze or when you laugh or doing jumping
or
jacks.
everyone says when they go to the gym and they like jump rope, they don't pee themselves anymore.
So nice.
Those are our happiest patients. But there's a whole world of female wellness, and it's not talked about enough. And we, Casey, both of anybody is happy to talk about that with anybody that comes in. And I think that it's awesome that we have all of these options that you aren't exposed to or can't get access to, and we have a whole
plethora
of
we've got
options.
A kitchen sink at aging, at wellness, but not only are we focusing on the downstairs, also the upstairs. So we have also other skin tightening devices. We talked about microneedling a little bit. We talked about BBL. So we also have Ultherapy, which is a really cool non-surgical facelift device. So it's basically targeting little balls of heat, as Sarah likes to call it, into the different tissues under the skin. So we can look at your skin with ultrasound and target exactly where, like, for example, on your neck, you have a muscle called the platysma, and that muscle pulls our neck down, which ages our neck faster than gravity, as Dr. Yune likes to say. So we can look at your skin through ultrasound and deliver heat precisely to where we want to deliver it, so you get that nice tightening effect. And then the study showed was actually a little temporary tattoo on somebody's face, and they saw that tattoo shrank about 20%. So it's best to stack these treatments, but it's awesome. If you're not ready for a facelift or even just upkeep for after a facelift.
Yeah, I was going to say, I think Ultherapy has a really great place. I feel like the most common conversations that, Ultherapy comes up in is the patient that everyone always like does this in the mirror and they want to fix this. And the patient that either isn't ready for surgery, surgery is a big move, so they're scared of surgery. They don't want the healing time. Ultherapy is a really great option to get that lift, whereas it's really the only FDA-approved device for non-surgical lifting. It's kind of like Casey said, with your collagen bank, we're constantly talking about your collagen bank and how you can't stop aging, but you can really like fill that bank up to continue to pull from it. And it's, to me, like the most like robust collagen stimulation. It's the big guns of collagen stimulation.
And when paired with Secret RF, that microneedling that we were talking about with radiofrequency heat, that's kind of like the Ultherapy is kind of the underlying support, and then Secret is just polishing off the top. It's like a shrink wrap effect, Dr. Yune likes to say.
Yeah.
So those are our two heavy hitters that we love to do together.
Yeah, they're very popular. And once again, we have Dr. Yune in office that is an amazing facial plastic surgeon, but some people always want to hear about the non-surgical options, and I think once again Dr. Yune's done a really great job of really kind of bringing in our clinic every option from skincare, stuff you can do at home, all the way to surgery and everything in between. And he's always said too, they're all best used when they're used together. I think everything has a really great place, and so we really do our best to kind of find the right treatment plan to use a little bit of everything to maximize your results. And on the screen is a I think we're going through some before and afters.
Oh, I love
This
these.
is
These are so
Secret. So this patient had one treatment of Secret, which is the microneedling with heat to help tighten that top layer. We have really, really happy patients with that. Minimal downtime. You're maybe a little bit puffy.
But it's worth it. That inflammatory process is what's going to help
Yeah.
create all that collagen.
This
Oh,
one's
I
super
love it.
popular. Doing it to the abdomen. We have a lot of people that after like carrying kids or for whatever reason have some laxity in their lower abdomen and maybe some stretch marks and just that like crepey skin that you start to get as you bend over. And doing the microneedling with the heat to that area can cause a really nice tightening effect, which people are really happy with.
I think we should also talk about cool sculpting for body contouring.
Yes.
Because summer is coming up, you know.
Bathing suit season.
Yes, bathing suit season.
Lake season.
So, cool sculpting is cryolipolysis, which is basically just the freezing of fat cells. Within each applicator, you're going to lose or have correction of about 20 to 25%. So like this, you know, any of our treatments, you want to stack them to get that wow factor. We always like to educate patients that, you know, it's not just going to be a one and done
Yeah.
type thing. I mean, you might be, but we
You
always
might
like to give
be.
that expectation.
Cool sculpting is super popular. I know at both of our offices, it's, you know, one of the busiest devices. Everybody hears about it, wants to do it. It's a really great device. It's going to give you, like Casey said, that 20 to 25% reduction of fat cells in the area treated. Basically, the way it works is that we put a little applicator over whichever area people are concerned with. Everybody has their different little pockets of fat that maybe exercise isn't getting, or a lot of people use it as like kind of like a Kickstarter to losing weight. It's 20 to 25% is it can be pretty significant in some people. Everybody has a different treatment plan. It's definitely something you'd have to come in office and have a whole consult about. But I think it was described one time as like, think of it like a vegetable peeler, just kind of like peeling off that top layer.
I like that.
Oh, we have a question. Okay. This question from Bethany says, do y'all provide any procedures or treatments for improving cellulite on the legs? So for cellulite, there's a couple options.
Well, it also depends on the type of cellulite, too.
Yes, definitely. Cellulite's a tricky one. We have a couple options. Dr. Yune does something called needle elevation. So needle elevation, basically you have a band that pulls that skin down, and that's where you get that dimpling. And so being able to cut that band, which Dr. Yune would be able to do in office, that's our best option for cellulite. But a lot of people mistake cellulite for wavy fat. So it's always good to come in office, have a consult. We can look at the area, talk about what area bothers you, and really your best options for that.
That was a great question.
Any more?
What else do we offer in clinic? We also offer some facials as well.
Oh, yes. Yeah. We have a question about hair restoration. Do you want to talk about hair restoration?
Sure. So I think the most popular hair restoration device that we have out there is really just using your own PRP. PRP stands for platelet-rich plasma, which is basically we take a sample of blood from your arm or wherever, spin it down in a centrifuge, and then we extract the platelet-rich plasma, which is that yellow stuff that's rich in growth factor.
Liquid gold.
Yeah, liquid gold. And then we inject it actually into your scalp at the base of the hair follicles to help with blood flow and thus create more hair.
I think that's our most popular option.
Definitely.
But once again, we try to give like a whole range. So
some people really hate needles, and they're like, I'm not putting a needle in my scalp.
If you hate needles, you can always start with, we have supplements in office that can help. We have shampoos and conditioners that can help with thickening. We try to really give you the full range because, everybody has price point, and everybody, like Casey said, some people have the needle phobia, which totally understandable.
Yes.
So if that's you, there's plenty of options. But I think one of the best option is a follicular hair transplant. And once again, we would love to have you come in for a consult. But basically, we take the tiny little hairs and pick them up,
Harvest it.
harvest it, and then put it maybe where you're missing some hair, and it's done follicle by follicle, so you can have a really natural result and have a really natural hairline. I think a lot of people have seen, once again, like some bad or something that doesn't look as natural, and that's not the only option. There's definitely natural great results that people are always really happy with.
Mm-hmm. And if you want something that's non-invasive at all, we could always do the hair laser to just bring blood supply back to that area as well. So we have options for everybody.
Yeah, you have to throw the kitchen sink at it sometimes.
What else do we have? ThermiSmooth. That's another great one.
ThermiSmooth is a really popular treatment.
We call that one the gentle iron. We typically do it under the eyes here, for those crepey, crinkly under eyes. So basically we're just ironing out those little lines. We typically do it in a series of 5. So basically it's just a heated probe that we literally iron out for a time that's just kind of dependent on the goals and patient tolerance, as well as temperature. About 42 degrees Celsius to 45 degrees Celsius.
And once again, with ThermiSmooth, you're just like, we're filling up that collagen bank, right? Mm-hmm. The area under our eyes is thinner. It doesn't have as many oil glands, so it ages a little bit quicker. A lot of our patients come in and complain about like crepey skin. They feel like when they smile, they have all those like little fine lines and crepey skin. So by applying heat to that area, we're really bumping up that collagen, thickening that tissue, and just prepping you also to correct it, but also for that skin to age slower.
Another question.
There's 2 questions right here at the bottom.
Okay. So one said, is there any treatments for under the eyes?
Yes.
Which we touched on with ThermiSmooth.
Yes.
We can also even talk about secret under the eyes.
Yeah, and then also that microneedling with radiofrequency device that we were talking about earlier, just basically pumping up that collagen. Everything we do is basically just trying to restore that collagen, make you look like you looked in high school, And then also you can do tear trough filler as well.
Yep, so when you look at we call it the tear trough because you end up kind of you have like a hill and then a valley and then another hill, and that's where a lot of the light shadow catches, where people feel like they just look really tired, like they have that hollow. So a lot of times, if it's a issue that can be fixed with filler, there's filler that can go in under the eye and kind of fill in that valley so the light doesn't catch it as much. That's an option. And then if this is another reason to come in office, but if you have what we call fat pads, which is a lot of times gives people that kind of like super tired,
puffy
look. Another reason that we're kind of full service is we have Dr. Yune down the hallway, and a blepharoplasty is a great option too. And I think we're really good about, if you're not a tear trough filler candidate, we're not going to put filler there. We're going to send you on to Dr. Yune and kind of send you in the right direction. Mm-hmm. Another question is from Sherry, says, is there a good time to do some of these procedures, for instance, summer versus winter? This is a great question.
That's a great question.
Absolutely. So anything that we're using lasers, so like BBL, laser hair removal,
or
microneedling. A lot of times when we're breaking the skin, you can do it year-round, but a lot of them are a little more popular maybe in the winter or fall, because most of the time after these treatments, we want you to stay out of the sun for a period. We really want you to protect your skin, baby it, keep it moist and sunscreened. Mm-hmm. So a lot of when fall and winter are a really popular time to do these.
And chemical peels too. That's always a great one to stay safe with in the fall, in the winter when we're not in the sun.
Yeah, and that's the way we consider your lifestyle too, and where you live. And that doesn't mean that you're limited to fall and winter to do things. We just kind of would talk through what your post-care would look like and decide the best time to do it for you. Another question is from Olivia. What options are available for treating a double chin?
Ooh, that's a great question.
It's a common question too.
So it depends on do you like needles? We have, if you don't like needles, we got you. So we'll talk about cool sculpting first.
Yes.
So it's that applicator that we were talking about. So we would place a small one right under here to get that 20 to 25% fat reduction or correction.
We would freeze that little area with cool sculpting, and then freeze it right off. And then over the course of 2 weeks to 3 months, that's when your body, after it's frozen, will start to metabolize those fat cells and get rid of them through your body's natural processes. We actually use the Cool Sculpting Elite machine, which is on our website. You can read about the Elite is the newest technology with Cool Sculpting, and we were, I think, the first practice in Georgia to have the new machine. And that's why we're able to say that, people even notice results as soon as 2 weeks, because with the newer technology, we're getting quicker results, better results, happier patients. It's easier on us.
Yes.
It's easier to use.
And it's just not as painful or anything,
Yeah.
You're able to work out right after if you wanted to.
No
You're not
downtime.
limited.
No.
Do you want to talk to them also about Kybella? So if
Yes.
you are into needles and you're okay with that.
There's also, Kybella is also a great option. So this is an enzyme that destroys fat cells. So whereas Cool Sculpting is going to get rid of that fat by freezing it, Kybella is going to get rid of that fat by kind of like melting it with an enzyme. And then once again, your body gets rid of those fat cells, naturally through its own metabolic processes. But with Kybella, you kind of the difference between Kybella and Cool Sculpting, right off the bat is swelling. There's some swelling that
The downtime.
the downtime. People that don't want downtime, which is most people, Cool Sculpting is a really good option. And then Kybella has a little more downtime. You're a little more swollen, but because you're doing injections, you can maybe tailor it a little bit better to people. So once again, they're all great options, but there's better options for certain people. And once again, I think we do a really good job of having you come in, kind of talking about everything, your expectations, what you want to see to be able to find the best option. And then there's always the option of surgery, liposuction, which Casey goes to surgery with Dr. Yune, so
I do, yeah.
she knows more about that.
So just quickly to touch on some liposuction, basically it's incisions, 2 small incisions behind the ear and then sometimes under the cementum here. That's a super quick and easy surgery. Dr. Yune and I do it like clockwork. So like we said, we have pretty much something for everybody. Whether you like needles, whether you like surgery, whether you are like no downtime, I don't want anything.
And then I have one more. It's a comment that I read on Facebook that I think ends this lovely. It says, I just had Secret with Casey and so happy with my results. I've been wearing a hat and sunscreen. She's the best.
Thank you. Oh, Angie, thank you so much.
Go ahead and read any comments you want, and then you guys.
Okay, gotcha.
Yeah. Dr. Yune and his team are amazing.
Thank you, guys.
Y'all rock.
Oh,
This is a patient that loves Cool Sculpting, so good for stubborn areas you can't lose in the gym. Very true.
you guys are all so
I think
sweet.
we answered
Thank you
most
so
of the
much.
questions.
Yeah, I think we did.
But we would love to see any of you in office. Give us a call. Come in and see us. We are only a small part of the team at ASC, but like we said, everybody's so great, and we would love to see you guys in office. Thanks for having us.
Thank you.